Why do I ruminate when depressed? Have you ever found yourself stuck in a loop of negative thoughts when you are feeling down? You are not alone. Many people experience this, and it is known as rumination. So, why does this happen when we are depressed? Let's break it down. Rumination is when you repeatedly focus on negative feelings or problems without finding a way to solve them. This is a common cognitive symptom of depression. When you ruminate, you might find yourself dwelling on past failures or losses. This kind of thinking can make you feel even sadder and more hopeless. The brain plays a big role in this process. When you are depressed, certain areas of your brain become more active, especially those involved in self-reflection. This network is called the default mode network. It tends to kick in when your mind is at rest, leading to self-focused negative thoughts. This makes it hard to shift your focus away from these distressing feelings. Stressful life events can also trigger rumination. When you face a stressful situation, you might start to think repeatedly about what caused your distress. This can happen even if you are not usually someone who ruminates. It shows how common this reaction is when dealing with stress, and it can make your depressive symptoms worse. Rumination does not just affect your mind, it can impact your physical health too. It can activate your body's stress response, leading to higher levels of cortisol, which is a stress hormone. This can cause inflammation and disrupt your sleep, leading to insomnia or poor sleep quality. When you do not sleep well, it can be harder to manage your emotions, making you feel more tired and less able to cope. In the context of depression, rumination acts as both a symptom and a factor that keeps the cycle going. It reflects how depression alters your self-perception, leading to a pattern of negative thinking that can be hard to break. To cope with rumination, it is important to use strategies that can help redirect your thoughts. Techniques such as mindfulness, cognitive restructuring, and behavioral activation can be effective. These methods encourage you to focus on more positive and productive thoughts rather than getting stuck in a cycle of negativity. In summary, rumination occurs during depression due to changes in brain activity that heighten negative thinking, cognitive biases that focus on negative information, and stress responses that trigger repetitive thoughts. Understanding this process can help you find ways to manage your thoughts and improve your mental health.